breaking all things down, you're here because of the shoulders, and that's all due to a parasailing accident and injury over there. So let's clue the viewers in. What have you been experiencing since then on?
Yeah, so during the parasailing accident, I had a few things happen. One, broken clavicle, dislocated shoulder on the right side, both sides. Just essentially that caused a chain reaction. Since then, I just had a whole bunch of issues happen year over year. So initially the shoulder pain on this side, and then eventually I started experiencing some hip pains.
Gotcha. Also, during the consultation, you also mentioned about the left rib
left rib distortion. Yeah, so essentially I noticed, so if I take a deep breath in, or just it kind of sticks out, it protrudes, and I can feel it, that it rotates, like it almost feels more shifted.
Actually, that's what I can see too, and I don't know if the viewers can see it as well. Is your whole entire torso down there is also rotated that way.
Yeah, and you can feel it, and it affects my breathing. So I get more shallow breathing in my stomach. It's just harder to take deep stomach breaths. So I breathe more from my chest. I notice that when that happens, I get more, almost like a sense of anxiety happens faster because my breathing pattern's not normal. So.
Gotcha.
Yeah.
And also, since the shoulder issues, you've also been having some headaches.
Oh my gosh.
Well?
Yeah. Anytime I experience my shoulder bothering me, my scapula, something just feels off. It goes straight up through, through my neck and into my jaw, my tenjai. And that's on that right side. So this same side that has this on my shoulder, and it goes all the way up, tightness, and then I feel it in my jaw, and that's when I start experiencing headaches. Headaches feel just pressure on my head. I always thought it was semi-work related, that I work a good amount, and but yeah, it's just anytime now, even if I slow down or I change my work pattern, it feels very heavy, a lot of pressure.
Gotcha. And also, clue us in, you mentioned about what happened to your left knee and the left ankle there.
All right, so I used to be a lot more into basketball. Now I can't really play anymore, but I sprained my ankle a bunch of times. From that, I basically, my knee, I used to think it was patella tendonitis, because I would have pain right underneath my kneecap. But no matter how much therapy I would do, I've done many months in a row. I've done stem cells in my knee. I've done PRP in my knee. Nothing helps. Every day, I basically, for the most part, at least 3 days a week at minimum, I'll do physical therapy. If I stop doing physical therapy for a period of time, it reverts back like I never did any, because I just don't. It doesn't track well, so my kneecap doesn't slide down, and because of that, it puts pressure on my patella tendon, and it almost like causes friction there. So can't run, can't do any impact. Sitting for a long period of time bothers. Can't stand for a period of time, like a concert. My body will start hurting from just long periods like that.
And go ahead, do us a favor, do a squat for me. Let's take a look. Yeah, that patella.
You can hear it crack.
Yeah, that patella's not tracking right either.
Yep. There it cracks again.
Got it. All right, let's take a closer look, see what's going on. Cool. When I hear about a case where, we got AC joint issues over there, especially with a trauma where you fractured it over there, then I want to see, is it biomechanically, in addition to it, we got the left ribs that's sticking out, and also the left knee that's not tracking right. So that all points out, tells me, says, we got some kind of rotation, a significant rotation in the entire spine that's like knocking everything out of alignment. So where is that rotation coming from, right? What's making this twist over here? So that means something down below has to externally rotate, right? So when I take a look at the pelvis down here, it says, we've got a gluteal fold going this way. But what's interesting is the fact that this is sticking down, and this is the PI ilium over here. So why is that interesting is the fact that we usually want to have a compound type of misalignment. As in other words, we don't want a magnet that goes like positive, positive, and negative, negative. It messes things up a bit. But somehow, in your pelvis, it's supposed, instead of being a PIEX over here, instead it's a PIIN over here, and this is ASEX over here. So it's, it's opposite directions over there. Now, I believe that at one point it may have in the past been a PIEX, okay? Because what I suspect is this trauma over here is what's caused things to switch around, the values, okay? So either it's switched around as this is as an ASIN, or this is a PIEX, or it could be the other way around, and this could be that PIEX and ASI on this side. Okay, we'll confirm that only when we do the examination. Mm-hmm. But in addition to, now we're also going to confirm, see what's going on you, that fork lumbar over here. And I'm going to make sure that this compensation didn't turn into a subluxation because of irritation, because when this gets knocked out of alignment and rotates significantly enough, your ribs are connected to this bone. So yeah. We may or may not, as I see, it's 50-50. So we'll take a closer look, see what's going on over here. And that's also what I see here as well. That second lumbar disc over here, it is puffy and swollen over here. Mm-hmm. So when we address whatever that rotation is in the pelvis, that should help calm this down quite a bit. We got the mid dorsal over here, okay, and we also got the side splits going on with the upper dorsals, because biomechanically that's what's controlling the function for your AC joints, and also your scapulars over here, because both your superior lateral scapulars over here. Now normally the bones over here, we want to have a proper alignment. But over here, I'm seeing all of these sticking out, okay, to the sides. Mm-hmm. It does so because the spine over here is supposed to have some gentle rotation over here. But because you have so much rotation in the spine, it sticks out like this. So this is what we call a side slip. So whenever I see that, that means we got some kind of severe EX rotation or posterior rotated sacrum somewhere in the spine. That's severe enough to make that kind of twist. In addition to, okay, I do see anterior rotated atlas over here. That means your head rotated a lot like that.
I can feel it, yeah.
Yeah. So looking down below, I do see a fit cervical, that's PL, and that's what I see over here. That's also in trouble here. In addition to, because that's rotated and irritated that nerve, this fit cervical nerve is also what's responsible for innervation to your shoulder muscles. Mm-hmm. So, it's like knocking out two birds with one stone. By addressing this fellow over here, it's going to calm down that atlas rotation. So it's going to calm down this TMJ you got going on over here, because it is sinking down on the right hand side and sticking out like this way. So we'll confirm that after we adjust this, see what's going on with that TMJ over there. Okay. And in addition to, that's what we mentioned about before, the knee. I'm going to double check on that. So if there's an EX over here, okay, that's going to rotate so much, what's going to do is it's going to twist your whole entire knee. So basically what's going on is because your hip, everything else, you rotate the EX this way, what's doing to your knee? It's twisting that knee over there, okay? So that may explain why you have some patella knee tracking issues over there, and we're going to confirm that during the joint examination.
Awesome. All right. That midsection in here, I can feel the shifting. It's very noticeable to me. Everything that you said, it's I'm very aware of it. So that's why as you go through it, I can nod along. But it's very odd. Like I can feel the shifting, and when it gets adjusted, other chiropractors will adjust that, but then I'll notice it shift back because it doesn't hit all of them at once. Mm-hmm. And I feel like when you obviously it stems from the two main injuries, it creates that pattern. So yeah,
we see a lot of swelling over here, a lot of tightness over here, swelling over here, swelling over here. See, this is supposed to be nice and smooth. See, this is swelling over here. This is second lumbar area. Mm-hmm. A little swelling here.
And I can feel it in here, like a lot. It feels very compressed.
Yeah, well, this is swelling over here, and we have a lot of muscle tightness on the right-hand side, too, more so than the left. So this is instrumentation right over here. So basically, when you have tissue that's damaged over there, it's going to start that inflammatory response, giving off abnormal heat. And that's what this device here is going to pick up here. It's going to help confirm our findings on you. Okay, yeah. Even though you have a read on that second lumbar, most likely that's really compensating. See with the lower dorsal here. Yeah. You're twisted like a pretzel here.
Oh my gosh, yeah.
Yeah, I see a lot of irritation to your nerves here.
You're telling me. I live with it every day. I feel it. It's very, very frustrating.
Sacral segments used to be okay. See, a little fixation, little jink here. But this right hip is just not moving. All right, we got that fella. Fourth lumbar's not moving too well. How's that fella right there?
Oh, the pressure right there, you mean?
Yeah.
Yeah, it's
Not too fun, huh?
Yeah, no, definitely not.
And I'll just second lumbar. Keep it on this one here too. See,
Felt the crack on the front.
you see,
Sternum.
yeah, a lot of these are compensations, pretty bad compensations. I'm not saying that we're going to adjust all of these. What we're going to do is this: we're going to adjust the majors first, and then we're going to reconfirm after each adjustments. See what we really need to address.
Okay. Yeah, that whole right side, I just feel a swelling all the way down on that right side when you're doing it.
Yeah. See, this is all swollen. Feel that right there, right?
Yeah.
Yeah, that's that fifth cervical. Right there.
Ah.
Yep, fifth cervical. There it is.
Oh.
There it is. Come on up. Okay, walk around.
Yeah, I feel better. I feel more balanced a little bit.
Good. What other changes you notice?
Yeah, I feel less protrusion, I think, or like less pushing in the back.
Good. Try the left ribs. How's the left ribs doing?
Little, I still feel it a little bit, but better.
Good.
Yeah.
Good. How much better would you say?
20-ish, 25%.
Okay.
Yeah.
Oh. Ooh. Going up, sir.
Wow, that was pretty interesting.
Okay, walk around, sir.
That's a little bit more different.
Okay, go ahead. Check the ribs.
A little bit better,
Yeah.
right?
Yeah. Another thing, go ahead. Do a squat.
No, it didn't crack.
The reason why he's doing that because the fourth lumbar nerve controls nerve function to the knee. That fellow over there supplies nerve function from here all the way straight down to the VMOs. Okay, so that's what the muscles we have over here. Okay, on the inside of our knees over here. Okay, I'll show to the viewers over here.
Okay.
So it's this muscle right over here. Okay, that's the vastus medialis oblique muscle. So when we have enough nerve function to it, what it does is it'll keep the kneecap in proper place. Now this is the right model over here, but you can easily flip it to understand. So the vastus medialis oblique muscle is right over here. So if we don't have enough nerve function to that, all the muscles here, they're still working. So what it'll do is it'll pull the kneecap to the outside of it. Okay, so that's why when you try to do a squat or bend your knees, it's not going to track right. So by restoring nerve function here, now instead of from here, now it's able to say, okay, fellas, now we're going to start pulling this fella back into the groove. And that's when you start doing this, and it doesn't become a problem anymore. I don't know. All right. Good. And now we're going to go ahead. Actually, go ahead, walk around.
That's funny. I felt like it went like, I don't know, something went.
Show the views over
Yeah. It went right there. like that second one that you did,
Mm-hmm.
I felt like a I don't know how to describe it. I felt like a signal or a twitch almost that it like vibrated something right in here.
Well, that's exactly what chiropractic is all about, man. We restoring nerve function in there.
Yeah, that was.
Gotta get the nerves working again. Okay, go ahead, walk a little bit back and forth and tell me what's different in there.
I feel, well, you didn't even work nothing here and
Not
out,
yet.
but I'm already starting to feel less of a headache. That's pretty good. I don't know if that is supposed to happen or not, but
No, it does, because we're untwisting the entire spine from the ground upwards.
yeah, like I'm feeling more clear. Even though you asked me to walk around, that's the first thing I noticed. Yeah, I'm
Check the
moving
ribs. See how the ribs are doing.
It's increasing again.
All right,
Still slightly, but not as much.
good.
Yeah.
All right. Yep, this is out. By a lot. No more.
Oh,
There it is. No more, right?
Oh. Yeah, right shoulder feels good. Feel a little bit on the left side still, I think on the left shoulder,
Okay.
but the right side feels really good.
Nice. Okay, now we're gonna check. So your SC joint, this is stuck. That's not moving. AC, actually it's not too bad. So first things first, we're gonna fix your SC joint. No more. No more. There it is. Now it's moving. Yeah, this is out. No, right there.
Oh, I've never got adjusted like that before.
AC slight out. Yeah. I don't know. It's not too bad. Yeah, this is out too.
Yeah.
Right there. Oh, right there.
Oh, that's good.
There's that fella. Okay, go ahead. Test the shoulders.
A lot better.
Yeah, show the reviews over here.
Now it feels. Oh yeah, now it's feeling better. This one. A little bit on that. I don't know if you hear it.
A little bit, yeah. But that's gonna take a while to.
But
to get up
that's the
there.
clavicle, right?
Yeah.
Yeah.
Because
The
it's
shoulder.
distorted, because that's not a smooth, because the fracture is, your clavicle is supposed to be here, but no. As you can see, it's really like peaked, like this way over here. So what it's doing is it is pulling several muscles here, and we see it, this muscle here is bulged. That's where it's attached over here.
Yeah.
So it's chronically elongating this muscle over here.
Yeah.
So no, that's a done deal for that fellow over there.
Oh, it's so much better. Usually when I go up and back, there's a lot of weakness. So one of the physical therapy things I have to do is put a band around both. I have to almost go like up, back, and down. And every time I do it, it kind of feels like the joint is just not held very good, and I can feel feels good. Feels a lot better.
Okay. Open, close, open, close. Okay. Open, close, open, close.
Oh,
Close, also. Do a little more than that. A little deeper. Open, close, open, close, open, close, open, close, open, close. Okay, try the jaw. See how I like it.
oh, now when I close, I can feel the muscle a little bit more in here.
Good.
When I like clench, right?
Mhm.
Yeah, feels more activated.
Nice.
I don't feel a crack at the top.
Yeah. All right, sweet. Let's get to the next.
By the way,
Yes.
this knee, this has held me back from playing basketball for 8 years. Just want to throw that out there.
All right. So, well, no pressure.
Yeah.
Yeah, it's missing. Pain right there, huh? Just a little.
Not as much, no.
Yeah, meniscus is kind of decent, not great, but slightly out. Yeah.
Yep, you felt that too, yeah.
Yeah, we're gonna set that. Oh, both of us.
I was just gonna say my right one, which is not common, but
No, the right knee's out.
yeah.
We're gonna set this first. Let it go. Little more. There it is. No. This one here, we're gonna pump this up first. A little more. There we go. There's another one. There we go. Here's another one.
I'm walking better than I did when I came in here.
Good.
So maybe slightly in my right one, a little bit, but not definitely a million times better before I walked in. And don't have a knee issue there, but I think something throws it off.
Because this knee was compensating from the distortion, the rotation from the pelvis itself.
Yeah. Got it.
Yeah. Okay, that is set.
Oh, I felt that in my hip too. Did you feel that?
That's a big one. Cube one, I gotta go too. Set this fella right in place. There it is.
Yeah.
Slightly out on this one too. I don't know. Good. Okay, walk around.
Already excited because I felt it. I felt it on the table. Yeah, now it feels better.
Feedback, brother. How's
Yeah.
the feet?
Feels good.
And how's the left knee doing?
Yeah, it feels good. Feels a lot better.
All right. That's what it's all about, brother.
Appreciate it.
You're welcome.